Welcome back to Body and Soul. Are you ready to take charge of your health? I know I am. I can't wait to talk to you about today's topic, but of course, Professor Lam, so good to see you again.
Oh, I'm so happy to be back and so happy about all the episodes we're going to do this season.
We're starting off with a very important topic. I've decided that we have to start with vaccines because suddenly we all understand how important they are.
Yeah, but it's been around for a very long time. And I have to say, much as we think we understand, there are a few misconceptions we need to clear up.
Absolutely, and that's why we need to start off with a basic understanding of how vaccines actually work. Professor Lam, can you help us with that?
Oh, sure. Well, let's look at the most common type of vaccine, perhaps the flu vaccine, the one you can get every year. Vaccines are basically composed of inactivated or weakened or dead versions of the virus or bacteria. And in this case, it's the influenza virus that gets injected into the system. Now, remember, these are dead, so they won't make you sick. But what they do is they travel to our defense system and help us create antibodies, which are things that can help us recognize the virus when the real virus infects us and help us mount a response so that we don't get sick the next time we're exposed.
That's important, but I also think a lot of us feel that a vaccine's going to cure us of a virus in our body. Is that true?
I think cure is the wrong word. What it does is it prepares our body to mount a defense the next time we're exposed to the virus. The problem with thinking that we're cured is that we think that we can't be exposed anymore. We can. So even if you're vaccinated, if you sit next to someone who has the virus, you can still get the virus. Yes, your body will defend itself, but why make your body work so hard in the first place? I think it's really important it goes hand in hand. Being vaccinated and also trying to avoid being exposed to viruses, like washing hands and so on.
That is a great point. And did you know that something like 2 to 3 million deaths a year are prevented because of vaccines? And vaccines don't just protect against things like the flu, they also protect against things like cancers even. How important that would be indeed. So let's find out more about how it could benefit you. But first, I know top of mind for a lot of people watching has to do with traveling. And when safe travel resumes, I think you're wondering if you need to know a lot more about travel vaccines. Let's find out more.
This might be very familiar to some of you. Needles for vaccinations. You might be asking, when am I going to get my vaccination? Or, I've already got one. But you know, Covid-19 vaccinations are not the only ones to be concerned about. How about travel vaccinations? Now, according to the Center for Disease Control and Prevention, recent studies have proven that the flu vaccination reduces the risk of flu illnesses by up to 60%. That is pretty good, right? Okay, now, great, flu vaccination, but you know there are many diseases around the world in different countries. So, which vaccination should I go for? Oh yeah, I'm here to find out. Okay, so now I'm going to test Dr. Julene Oon on all the countries and every vaccination needed per country. So Dr. Oon, which vaccination for which country, eh?
It's very easy actually. All you have to do is go on to Google, type in US CDC Yellow Book on Travel Health, and all the information will be there available for you. But unfortunately, it can be quite a little bit of an information overload, especially for the public. And sometimes, depending on your general health status, certain vaccines may not be suitable for you.
And I hear there's something about needing a vaccination to come back into Singapore?
So when you're actually traveling to yellow fever endemic countries like Africa, South America, then you need to show proof of vaccination. It comes in a very nice little yellow book like this.
That's
all right.
helpful.
So essentially, you need to get your vaccine at least 10 days before the travel itself, because that's about the time it takes for the antibodies to develop to provide you with the protection. So if you have a prolonged travel to an endemic country, or it could potentially be a short travel, but you're an adventure traveler, then we would recommend rabies or even Japanese encephalitis vaccine. Other than the yellow fever, which is mandatory, another vaccine which is mandatory for travel is actually meningococcal vaccine, which protects you from meningitis. And this is actually recommended for travelers to Saudi Arabia, where they perform the Hajj or Umrah. But what is important to remember is vaccines and tablets are not 100% protective. As such, we will still always advise travelers on the necessary precautions. For example, your usual food and hygiene practices or mosquito avoidance measures, right? Like use of insect repellents or wearing clothing that covers most of the body.
Hazmat suits. No, okay.
No, that's too much.
Oh, that's good. And you know what? It's all about protecting others as well, not just yourself,
Yes,
right?
correct.
Okay, well, thank you. Now we know how to find out which vaccinations are required for which region. So, never too early to start planning. Speak to your doctor to find out more and stay safe.
Coming up, we'll meet our celebrity guests who know about the power of vaccines, but still might be a little apprehensive. We'll hear all about their stories next on Body and Soul.
Have you been vaccinated? Well, if so, then you probably know that side effects like a sore arm, a fever, a headache are quite common, right? And although they can be a little bit uncomfortable, these side effects are perfectly normal. In fact, they can be a good sign. It can mean that your body is building protection. But is there a way to reduce this discomfort? Well, I'm about to find out. Hi, Sarah. Okay, so tell me, what are some of the common COVID-19 vaccination side effects?
Some common side effects include pain and tenderness upon the injection site, mild fever, headache, diarrhea, muscle pain, joint pain, and general body weakness. The severity of these side effects may differ amongst individuals.
Now, the youth are being encouraged to get the vaccination. Would their side effects differ from people from other age groups?
For the younger age group, especially the youth, they generally have a stronger immune system as compared to the adults and elderly population. Hence, they are more likely to experience the mentioned side effects.
They will most likely get the side effects because of their immunity.
Yeah, they have stronger immune system as compared to the elderly and the adults.
Can paracetamol alleviate some of these side effects?
Yes, paracetamol is a painkiller as well as a fever reducer. They serve as a symptomatic treatment for fever, pain, and body aches. You can easily buy paracetamol, example Panadol, over the counter in all Guardian stores. The recommended dose for paracetamol is 1 to 2 tablets of paracetamol 500 milligrams every 6 hourly as required.
But will painkillers like paracetamol affect the vaccination's efficacy?
It's not advisable to take painkillers such as ibuprofen and paracetamol before vaccination as a prevention, as this may possibly weaken the immune response. As there's no concrete data on the effect of this medication on the vaccine effectiveness, we therefore do not recommend to pre-medicate before vaccination. However, it is still recommended to take paracetamol after vaccination if fever, pains, or body aches occur. This is to help to relieve the discomfort of these symptoms.
Now, what happens if those side effects last for more than 48 hours? Do I panic and come look for you?
Usually, the vaccination side effect lasts about 24 to 48 hours, at most 72 hours. You should consult a doctor if you experience any of this scenario. 1, if your side effect persists or gets worse. 2, if your fever persists for more than 48 hours. And 3, if you develop any respiratory symptoms such as coughing, running nose, sore throat, shortness of breath, or the loss of taste and smell. You should also consult a doctor immediately if you experience any of these severely allergic reactions such as difficulty in breathing, swelling of the face, and the bad rashes all over the body.
Now that is one less thing to worry about when we get vaccinated. So, the next time you get your shot, don't stress about the side effects. All good. Jab me, baby.
Just like many of you, they've got so many questions about vaccines, and they're here to get them answered. Please welcome to the show host and DJ Barbara Latimer and actor Chen.
Hello.
Hi, guys.
Hi.
Come, have a seat with us.
Yes.
So
Thank you for having us.
excited to talk to you. Everybody has so many questions about vaccines.
I know. It's definitely one of the hot topics of the year, I think.
You come to the right place, don't you worry, because I also understand that EC has actually had a vaccine done quite recently.
2 years ago, actually.
2 years ago.
Yeah.
Not COVID then.
Not COVID. It was before COVID. So I was about to go overseas for a trip for hosting. I think that's where I met my sister. So we had a flu jab. I think I had a flu jab back then. So I think it's about time to have another jab. I'm not so sure, so maybe that's why I'm here.
There are some vaccines where you don't really need to keep repeating them. And all you do is just check if you're still immune, and that's okay. But the flu vaccine you do, you know why?
Why?
Because each season that comes, there are different vaccines that are seasonal. So like fashion, you have to be prepared for the season.
So we always have to change a different kinds of vaccination.
That's right, that's right. It's predicted based on science, what we anticipate is going to be the type of flu virus that's going to be really, really rampant. And then the vaccines are going to prepare you for those viruses.
But then how do we know like what we're supposed to take and when? It's not like you get like a notification email like, hey, this is the vaccine that you should probably take this year.
Actually, maybe you should be glad that you're not getting the notification, because people at risk who are elderly and who've got chronic diseases and so on do get notified. So we should, as doctors, we notify our patients. I have patients that every year they know you have to get vaccinated because they're at risk. They've got chronic diseases or they're older. You're obviously very young, but if you travel...
No, but you're absolutely right. There are so many vaccines. How do we know which ones that we need to take? Yes. Are you also interested in the influenza vaccine?
Well, I mean, I've just kind of not really a big fan of needles in general, so if I can avoid taking vaccines and having needles, I would. But I think as you get older, you just need to be a little bit more aware. So, you know, with all the talk of vaccines happening, I'm like, so what are the ones I should be getting then?
Actually, I'm also curious about the Hep B vaccine, but I'm not sure like how it goes and how many vaccines we could actually take. Yeah, so I have a lot of questions, so can I bomb out with you a bit?
Oh, definitely. So hepatitis B vaccination is so important because we are living in an area where it is endemic. For example, I can name family members who have been hepatitis B positive and they get it through birth process from their parents.
Right.
And because it is a risk factor for cancer. So here we're talking about vaccine that can actually prevent cancer in future as well. I mean, this is really landmark in medicine that we now know viruses cause some cancers. So hepatitis B is one of them that is good to get.
Did you realize that hepatitis B could lead to liver cancer? It's one of the leading causes traditionally.
I'm mind blown right now.
I'm actually aware of it because a very close friend of mine, I think, passed away from hepatitis B a while ago, 2 to 3 weeks ago. So,
I'm sorry to hear that.
So it's actually a concern because for us Singaporeans, a lot of us we are blessed to have the vaccine as a kid. But I was just wondering, do we take this vaccination once and we're okay for life, or do we need to constantly take it, as you mentioned? And what are the things we should look out for? Hepatitis B come from food? Does it come from environment?
Very, very good
hepatitis
questions.
ABCs.
Right. And literally it's the ABCs. So I'll just simplify it. Hepatitis A is the one you get in char kway teow, siham. Okay, so from food, all right? That's the one you get an acute illness, that's it. Hepatitis B and C you get through bodily fluids. Through the birth process of transmission, through exchange blood, birth process, sex. So those are the ones that can last longer. And the good news is, though, once you have been vaccinated and are immune, you don't need to repeat it. So this is not the one that you have to do every year. It's the same virus. Cool.
So this is exactly what I'm talking about, the power of vaccines for everything from the flu to potentially something that could lead to a cancer. That's how powerful vaccines are. Let's get all your questions answered. And that's coming up in the next segment. I brought a specialist along, and maybe he might have brought a couple of needles. Who knows? You guys interested?
I mean, are you getting involved in this too?
I won't be administering anything, that's for sure. Don't worry. Stay tuned. It's all coming up next. More of your important vaccine FAQs coming up on Body and Soul.
Technology can definitely help with prevention. At-home DNA testing is a fad right now. What is it? Well, we all have DNA, which is a chemical database that provides instructions for how the body functions. Genetic testing actually means analysis of this DNA, which can reveal mutations or changes in that chemical database that can signal a risk for disease. Now, can you do it at home? Very easy. You just swab your inner cheek or spit into a tube because your saliva contains DNA. However, before you rush to get your home kit, remember 2 things. First, test very widely in terms of credibility, depth, and cost. Please check for lab accreditation or talk to your doctor. Secondly, please consider what you would do with the results. You see, the test will tell you what's in your genetic code, which you cannot change. So it can have a big psychological impact, and you may need an expert to understand it. Remember, a good test should actually spur you to take on lifestyle actions to prevent disease. And that was your MedTech Minute.
It's demo time on Body and Soul, and joining us once again, it's our celebrity guests, Barbara and EC, on our Body and Soul examination table. Hi, guys.
Hello,
Hanging out on the surgical table.
Yes,
Yep.
Looking good. And I know you have very important questions, and that's why I've invited Professor Paul Tambyah back onto the show. Good to see you again, Professor Tambyah.
Hi, how are you?
Very, very well. So excited about these important questions that our guests have. And I think key amongst them is whether or not vaccines work. Can we actually show that it does?
Actually, we can. And I have this set of wells provided by my colleague, Professor Sylvia Alonso from the Department of Microbiology. And what you can see here in the first set of wells, we've taken the blood from a patient and then we've injected the virus into it. And these little white dots are when the virus is growing. The next set of wells is after you've vaccinated the patient. So you take the blood again, you do the same thing, you put the blood in the wells, and then you put the virus in there. And voila, the virus is not growing anymore.
That is a lot less of the virus right there.
There's actually none, you can see.
That's phenomenal. It shows it works.
Exactly.
And I mean, I believe the science. You know, I'm sold. I understand how it works. But I think my question is, like, I've never really been heavily affected by the flu. You know, I haven't come down with it really, really bad. So do I actually really need it?
Well, you know, to be honest, young people usually don't get very severe cases of the flu, except in certain occasions when it can affect the heart, or very rarely it can affect the brain. But what young people do is they spread the virus to the elders around them. So, you know, getting vaccinated against the flu protects you, but it also protects your grandpa, your grandma, and all the people around you.
Okay, that's heavy. All right, so I'm convinced.
Yes.
So there is a reason for me to get vaccinated, because I think in this case, it's very much prevention is better than cure, not for me, but a lot of the time for the people around me.
That's right.
That is a perfect way to understand the community effort that's needed with vaccination, how it benefits so many more people than just the individual.
For the hepatitis B, I'm curious to know how does it go? I heard there's phases for it and stuff.
Yeah, well, unlike the flu vaccine, the hepatitis B course of vaccination comes in 3 doses at 0, 1 month, and 6 months. And you actually have to get a blood test done before the vaccination to see whether you are actually naturally immune to hepatitis, which a certain proportion of individuals are, because they may have had the disease as a child. And so they may have natural immunity. So if you do have protective immunity, you don't need the vaccine. But if you've never been vaccinated, the chances are you will need the vaccine. So you will need to go to your GP and sign up for a course of vaccination.
Right.
So I'm convinced that, yes, okay, there are all these vaccines available to us for different things, and I can go to the GP, I can go and find out what I need. Am I okay to get more than one vaccine done at a go? Like, are there any risks?
Well, actually, we do recommend getting more than one vaccine at a shot. And the reason is because, you know, adults, they think vaccines are for kids, they're for little babies. And we don't, you know, plan to get vaccines as adults. So we do what we call opportunistic vaccination. You know, in the days before COVID, people would only get vaccinated when they wanted to travel.
Right.
So we'd say, oh, you're traveling, you need a hepatitis A, you need a typhoid vaccine. But by the way, you know, you haven't had your Hep B vaccine, or you're due for your human papillomavirus vaccine. And so we would try and get as many vaccines as we could just to make sure that people were up to date with their vaccination.
Right.
Okay, so I think that the key there is just to make sure that everyone is aware that you can just go and get it done.
Exactly. Every GP in Singapore practically offers vaccination. And you can go to a polyclinic or you can go to a travel clinic and get vaccinations done too.
Isn't that amazing? It could be so easy.
Yeah.
Do you know what? I'm sold. I think I'm going to go and get, go and make an appointment.
Shall we book it?
We'll book it.
Yep.
You're going to be my accountability partner.
Yes, we'll be there. We'll be like going through it.
You're on Body and Soul. Don't even worry about it, because I've sorted it out for you. Right here on set.
That's easy.
An influenza vaccine, which Barbara was interested in, and I think EC's on board.
Definitely.
Barbara, it's your first
we're going
ever.
straight into it. Okay.
Yes. I'm all ready. I'm going to get my jacket off.
This is harmless, right? No, okay.
Are you having like, ooh, look at it go.
Oh, okay. I'm not a big fan of needles.
Your first ever influenza vaccine!
She kept smiling all the way
I think it was
through.
just great that I had all these
That's
distractions.
impressive.
Yeah, you were just like looking at us.
I think I did really well considering I hate needles.
You did really well.
Good job, me. Good job, Barbara.
Good job, good job.
And Issa, it's your second ever.
Yep, I just had mine 2 years ago.
Fantastic.
So, yes.
Ready for dose 2 here?
Bring it on.
Let's do it.
There you go. I think the previous time I had like 4 to 5 jabs at once.
All right.
So yeah, it was opportunistic vaccination.
Well, this time you're only going to get one.
Yeah. Oof. Thank you.
Even watching it go in is just like, oh.
Oh, you should just like
Yeah.
jab it more.
She's a pro. Yeah.
She's like,
Thank
third
you.
time, job done.
Guys, that's
Thank you.
amazing. How did it feel? I know you're not a fan of needles. How did that feel?
It was okay. It was quite painless. You know, you obviously feel the prick, but no big deal, actually.
Just slight pressure and it's
Got
done.
my big girl pants on.
Amazing. Thanks so much, you guys, for being a part of Body and Soul.
Thank you.
Professor
Thank you much for having
Tambyah,
us.
thank you for answering all their questions as well. Great
Thank you
job,
for having
guys.
us.
Well done. And now you're protected against the flu.
And protected to get no flu for me.
As we've learned, vaccines save lives, and there's so much that we can do to prevent anything from the flu to a cancer with a vaccine. Professor Lam, what are the key things to remember?
Okay, here you go. Top 3 points. First, prevention is always, always better than cure. Second, vaccines are the way we prevent ourselves from getting sick by viruses and bacteria that we commonly encounter. The third thing, if you travel, the things you need to vaccinate yourself against are going to vary. So please talk to your doctor.
Professor Lam, you forgot the fourth thing. Enhance your health knowledge by watching more Body and Soul. And you can do so anytime right now via MeWatch. So head on over there to catch up with all our previous seasons. Thank you all for joining us at a brand new season of Body and Soul. We've got so many great topics lined up for you. Can't wait for you to continue this journey with us. Thank you for joining us and stay always in the best of health. Bye, everyone.